video I'm going to be covering Sever's disease. I'm going to be looking at what it is and also what it isn't. I'm going to be looking at the causes of the condition, how to prevent it, and if your child does have it, how do you treat it and get the quickest and best results. Firstly, what is Sever's disease and what it isn't? Usually when people hear it, they hear the disease part and often, worry, and anything associated with disease is worth worrying about. This one, not so much. It's what we call an inflammatory condition. It's an inflammatory condition of the heel joint, specifically the growth plate. When your child is going through a period of their life where they're growing a lot, the muscles and ligaments around the heel, specifically the ankle joint, can't keep up and maintain that flexibility. So what ends up happening, you have quite a severe and acute inflammatory process in that joint or in that bone, causing extreme pain in the heel. That's what it is. Now, what causes that? The biggest causes of Sever's disease is going to be really, really tight calf muscles during a period of rapid growth spurt. Now, that rapid growth spurt will typically happen for kids aged from 8 right up until the ages of 13. Outside of that age group, you don't often see this condition. If you have the child that's playing a lot of sports, so they're playing the soccer, football, basketball, tennis, a combination of sports throughout the week, and they're using the calf muscles and you're not maintaining the flexibility or the elasticity in the muscles around the joint, it will start causing a lot of pressure on that growth plate. The other thing that can cause it if you have biomechanical changes in the ankle or the foot. So if it's turning in too much or turning out, what we call pronation or supination, that's something that you want to take action and see a physio or a podiatrist about. They're experts in that field, and it's really important that biomechanics of the foot gets corrected as early as possible. I often get asked, how do we prevent this happening? Maybe it's your eldest child that has a condition, you've got 2 younger kids that are coming through and you don't want them to get it. Really, the biggest 2 things that I encourage parents to do is to maintain the flexibility of the calf muscles coming up to their growth spurt. So in the years leading up to it, in the ages 6, 7, 8. It's really important to maintain the flexibility of it so when they go through that period of rapid growth, you're not playing catch up with the flexibility. The second thing that I encourage parents to look at the mechanics of your child's foot. Making sure that they're walking properly. They're not turning in, they're not turning out. Especially after the ages of 5, you want to be identifying these problems as quickly as you can. And that's a time period you can take a lot of action and make sure that the foot's under as least amount of stress as possible during that age where they're growing a lot. So how do we treat it? The biggest thing initially when you have the condition is to make sure you're stopping activity or limiting it, making sure it's at a minimum. Unfortunately, this is a condition that needs time to heal, needs time to recover, and I know that you may be in the midst of a final series or playing lots of sports and you don't want to miss out on everything. To ensure long-term recovery, initially you have to take a break. I always encourage your kids take 2 to 3 weeks off and then slowly introduce activity. You may want to, instead of going to 2 trainings a week and then a game on the weekend, you may want to be just looking at playing half a game initially, and then maybe playing 2 20-minute halves of the game, and then training for half of the training session and slowly start introducing it back in there. What you don't want to do is you don't want to have a block of time off and then go straight back into it, because unfortunately you'll just end up with the same symptoms coming back. Symptomatically, when it's really acute and very painful, I encourage kids to ice the joint. Ice it for a period of 10 to 15 minutes, take a break for an hour and repeat that process. That'll just calm down the inflammatory process and just help with a lot of the pain, because it is something that can be very acute, very uncomfortable during the day. Specific movements that you want to avoid walking up a lot of stairs if you can, and you want to avoid doing any sort of heel sprints or walking up hills where it puts a lot of stress on that area. There's 3 different forms of stretching you can do for the calf muscles. Firstly, you can do what's known as static stretching. Secondly, you can do dynamic stretching. And then third, which I strongly recommend, is using a foam roller to increase the elasticity and the flexibility of that muscle. First, I'm going to cover the static stretching, and this is just a stretch and hold movement. So there's 2 phases to this. The first One, you want to be keeping your heel on the ground, your hands below your shoulders, and you want to be leaning forward. You can put the other leg on here and just apply a little bit of pressure leaning forward. Holding that for 30 seconds and then dropping the knee forward. Heel comes off the ground and you're stretching the soleus muscle, which is a little bit deeper and attaches specifically to the Achilles. Secondly, you can do a dynamic stretch. And this one's where there's light movements. Now in both these stretches, you don't want to be doing it to the point where it's painful. If it is painful, back up a little bit. Don't do it as much. All right, so starting again, hands underneath the shoulders and just lightly trying to touch the heels on the ground. You want to be doing it in a slow, controlled movement. And then the third one, foam rolls are very effective at increasing the mobility of the calf muscles. I always encourage you to not only stop at the calves, but to also do the hamstrings. The hamstrings get really tight, especially during the day when you're sitting down a lot. What I'm going to be doing is I'm going to be starting at on the Achilles. Now I want to get my hands underneath my shoulders and lift my body up and it weights. And then I'm going to start with my toe in. I'm just roll backwards and forwards and slowly turn my toe out. And then slowly come back in. And then what we can do is we can roll in a little bit more where the foam roller comes up the leg and start again. Toe in and toe out. You may find at the start this is very uncomfortable and very painful. If that's the case, try putting a towel around the foam roller and don't bring the weight up. As you start getting more and more flexibility in the calf muscle, you'll be able to put more and more weight on it. You want to do this process and work all the way up, right up to the knee joint. And then after you've done that, start on the hamstrings and same thing again, turning your foot out, all the way out, then all the way back in. Now, when you get to a point where it's not painful and not uncomfortable, what you can actually do is you can weight this. So I'm going to put my other leg on it, and I'm going to raise up, and I'm going to do that same movement. You're just applying a little bit more force, getting a lot more flexibility and a lot more tension through that muscle to try and break up those adhesions through the muscle. And you want to be doing that process all the way up your leg. I also encourage parents to get their kids' foot looked at from a podiatrist. You may find that putting a heel lift will take a little bit of the pressure off that growth plate and also aid in getting a lot of tension off that area. Any other soft tissue work, whether it's be through a massage therapist or a physio, really working the muscles and getting that mobility, it's all going to help and increase the chance of recovery.